People was very interested about the different management of, for example, black triangles. The different managements, especially about the polishing and the finishing of posterior restoration. One of the things that it is challenging and sometimes is uncomfortable for dentists is to finish class 2 restorations. With this approach instead we have most of the excesses. This is the beauty of this method. Okay, I am Dr. Maiolino, I come from Italy. Exactly, I come from Sicily, the small island in the south of Italy. I am specialized in prosthetic and restorative dentistry, and I'm focused a little bit more on vertical techniques and on the biocare approach about restorative dentistry. It's a technique where we combine a sort of injection molded composite. And this has been also the topic of my live demo this year in the dental world. I did a live demo about black triangles restoration on anterior, mostly on patient after orthodontic treatment, and I did also a live demo about class 2 molar restorations, always with this approach. I did several live demos. I did a live demo about anterior restoration and posterior restoration with this approach. The approach uses some special material coming from US. The name of this material is BioCare matrices, but it is not just some different material because these matrices are done in the mylar, so it's a transparent material. But it's a complete different method. In the BioCare method, in fact, we do a different kind of cavity configuration. There is a lot of focus about the management of the substrate. We do always blasting after the identification of the biofilm, for example. There are different matrices. We have different matrices with different profile, different curvatures in order to manage different kinds of black triangles, normal anatomy, or for example, matrices for diastema. And even on posterior, we have different curvatures, and we have also some special techniques with whom we can customize also the surfaces. This is an approach that, in my opinion, you can solve things that are not easy to solve with other conventional techniques. This approach is much more reliable in, for example, black triangles, diastema, these kind of situations. There is also another method to apply composite, not with layering, but these are monolithic injected restorations. And I saw that there has been a huge interest because it's also something that it is new for dentists. And so that people was very interested in this kind of hands-on. Okay, about the live demo, I see that people was very interested about the different management of, for example, black triangles. The different managements, especially about the polishing and the finishing of posterior restoration. One of the things that it is challenging and sometimes is uncomfortable for dentists is to finish class 2 restorations. With this approach instead we have most of the excesses, this is the beauty of this method, are located in the middle of the buccal and palatal wall. So in this area it's very easy and it is very fast also for the average dentist to do a proper polishing and finishing of this restoration. All the BioCare method is focused on solving everyday problems. And this is the reason because I saw a lot of interest from people, because sometimes we focus too much on the artistry, on dentistry, and we forget all the small daily problems that we have. Of course, we don't lecture all the day, we don't do live demo all the day, so I spent several times going around. I spent time in the endodontic course, in the endodontic hall, I spent time in the aesthetic one, I went around a little bit. And every year I have to say that I am amazed about the quality of the speakers and the lectures and about how up to date are these kind of lectures for both the new dentists and both for experienced dentists. There is a huge research also on complex cases, and this is something that I really love. Dental world is a fixed appointment in my life. Every year is always in the middle of October. I'm coming here since 5 years, every single year. And I just want to say that I will come here every year in the future. So I just want to invite you to come to Dental World and to see all this great exhibition and all these great lectures. See you next year in October, in the middle of October 2025. Bye.